Hello, and thank you for joining today's webinar. We are ready to begin. Today's webinar is eligible for one contact hour. Sigma Theta Tau International Honor Society of Nursing is accredited as a provider of nursing continuing professional development by the American Nurses Credentialing Center's Commission on Accreditation. The speakers and planning committee members have disclosed no relevant financial relationships. To receive contact hours for this session, participants are required to attend the webinar and log into our LMS to complete an evaluation form. Information on how to access this will be emailed to all attendees approximately 1 week after the webinar. The webinar is being recorded and will be available via the Sigma repository within a few business days of recording. Following the presentation, we will have time for a question and answer session. You'll see on your GoToWebinar control panel that you can send a message through the questions feature. This is where you can type in any question you'd like to pose to the presenter. Be sure to hit send so the message makes it to us. We would like to thank our speakers for sharing their expertise with us today. Our speakers are Penny Sessler-Brandon, Valerie Clary Miranda, Janice Hawkins, Dania Itani Musa, and Arik Shimmick. For Dr. Sessler-Brandon, her love of maternal child health and the rights for health care by all women have always guided her decisions regarding what she does in nursing and midwifery. Dr. Sessler-Brandon's experience includes clinical excellence, leadership, advocacy, and education nationally and globally, for which she has received numerous awards. Dr. Sessler-Brandon has always loved and continues to contribute to nursing and healthcare in whatever form that takes. Dr. Clary Miranda is an assistant professor at Thomas Jefferson University in Philadelphia and a Sigma Liaison to the United Nations. She is a strong advocate for maternal and newborn health rights. Dr. Clary Miranda seeks to improve the visibility and participation of nurses in UN efforts targeting global health disparities. She coordinates a high school enrichment program for students aspiring to become nurses and serves as a member of the New Jersey Board of Nursing. Janice Hawkins is a clinical associate professor at Old Dominion University, where she serves as director for the Nurse Executive DNP concentration, as well as director of community and global initiatives. She is Sigma's most recently appointed UN liaison. She is also a state leader for the UN Foundation Shot at Life campaign. Her travels all over the world have led to a greater awareness of global health challenges. Dania Itani Musa is a registered nurse and DNP F&P student in Los Angeles. She is also Sigma's UN Youth Representative. She is a global advocate for youth and empowerment for early career nurses. She is pursuing excellence in nursing practice throughout advocacy and leadership. Arik Shimmick is a telehealth program manager at Ann and Robert H. Lowry Children's Hospital of Chicago, a second career nurse called to the profession after the 2010 Haitian earthquake. He blends international business acumen and nursing skills to promote health equity and advance the nursing voice in tackling today's healthcare challenges. His passion has led him to serve in several leadership roles, including his current position as a United Nations liaison for Sigma. Now let's go ahead and get started with today's presentation.
All right, thank you everyone for joining us today. My name is Arik, as was mentioned, and good afternoon from Chicago. So we have a lot to get through this afternoon, and I just wanted to share again our thanks for joining us. So I'm going to move kind of quick through the first couple slides here. So really the key messages we want you to walk away with today are: you as nurses already advocate every day, and we have the opportunity to really grow that both at home and up to a global level. We want to show you how to use the SDGs as a pathway to do so, and to prove to you and show you that you have support and representation from Sigma. Like I mentioned, we already advocate every day for our patients and for our positions and for the nursing voice in all of our decisions. And when we looked at the chapter reports for last year, over 85% of the reports had some sort of service project which aligned with the SDGs. So if nothing else, I want you to go away today knowing that you're already doing this work. Here are going to be some ideas on how we can move and do more. So next slide, please. So just to level set a little bit here, what is the United Nations? It is a global member organization of 193 countries that was founded after World War II. They primarily address the issues that every country has an influence into, but no one country controls completely. So when we talk about things that make the news, right, you've probably heard about them maintaining peace or talking about humanitarian aid or something with international law. But they're also very heavily involved in things like climate, labor, economic matters, and gender equality. The structure of the UN is roughly 6 major organs. Sigma has a special accreditation to join the Economic and Social Council, which is the second largest of the 6, and is also the same family as the World Health Organization. Next slide, please. So you may be asking yourself, well, why do we do this? Why do we go to New York, and why is this important? And these 5 reasons here on the slide really outline what our team is trying to do at the United Nations. First and foremost, we are there to represent you, the work you do, and the work that nurses around the world are doing for the SDGs. We also want to make sure that we're there to provide the expertise of the nursing voice and to really encourage those conversations about why nurses should be involved at this level of decision making. We promote advocacy, especially around health, and we want to make sure that we as a team are taking the information we learn from the UN and getting it back to our chapters, getting it down to the local level, to the individual who may have an idea of a project to do that would have impact both at home and abroad. Next slide, please. So what do we do at the UN? Well, I have to be honest, I probably wasn't expecting this when I first walked into the position, but it is an incredibly full day when you go to New York. So we pretty much do anything and everything we can. You know, it usually starts with an early morning breakfast meeting, finishes late in the evening with some sort of reception or award ceremony. But we're there to really do all those things we talked about on the other slide, and that gives us really the reach to go out to any event that we can get into. We're really there predominantly through the major events of the year, like the Commission on the Status of Women, the UN General Assembly, high-level political forum, and other like civil society events that go on. But we're there really to attend these sessions and to ask questions and to provide written statements and really to help people see the connection between nursing and the work that the UN is doing. And that's why we go to such a wide variety of events held by a wide variety of hosts. I will say lastly that most importantly for me in my experience, I've learned that most of our work kind of happens in the hallway. You know, we'll go into a session and the presenters do their piece, and then there's conversation, and in that conversation our team is raising your concerns and telling your stories, and that starts these conversations in the hallway where you get pulled off to the side and say, wow, I never thought about nursing in that perspective, or I never thought that nurses would have such an important role in doing something like disaster preparedness, right? Which to me makes no sense given that we're often the first responders. But that's just one example of some of the work that we do and how we build relationships not only with the people that think like us and have the same interests, but more importantly, how we talk and connect to other groups that maybe have never thought about having a nurse at the table, and that's where some of our largest impact can come. Next slide, please. And with this, I will pass it over to Valerie in Philadelphia.
Hello, all. I'm going to talk about nurses as advocates. We often use theoretical frameworks to develop sustainable interventions for health issues. So this is a social ecological model shown here, and it offers an integrated approach to achieving the United Nations Sustainable Development Goals, and it could be particularly useful in monitoring progress towards achieving outcomes. A social ecological model addresses the complex factors that can significantly impact interventions, with the aims of addressing these factors at multiple levels to improve the likelihood of sustainable outcomes. So nurses and midwives are advocates at every level of healthcare, the individual, the interpersonal, community, organizational, and policy levels. On a global level, nurses and midwives provide healthcare to many, including the most vulnerable populations we care for. Because of this proximity to the most marginalized and vulnerable in our societies, we are really in a position to recognize the widening gap of social inequities and health inequities and their negative impact on health outcomes. As first responders to health crises, we are well positioned to lead efforts to improve global health outcomes. Next slide, please. Skills for advocacy. The role of the advocate is well suited for nurses because we as part of our jobs, we advocate for individuals, families, and populations every day. However, there are some skills that can maximize advocacy efforts, such as knowing what the relevant issues are, having a well-prepared plan, familiarity with stakeholder interests, good communication skills, an organized process to attend advocacy sessions, identification of co-advocates, materials to lobby and support campaigns, and then a strategy to establish a consensus and deal with divergent views, because it's really possible that you may meet people in these spaces that have quite different views than your own. So you should have a strategy to deal with those views. Next slide, please. Advocacy comes in many forms, and those forms are not limited to those examples that I have listed here, such as starting or joining a campus advocacy group, identifying local health issues where advocacy is warranted, engaging faculty leaders, working with other advocacy groups like churches, community organizations, grassroots organizations, working with leading advocacy NGOs, writing to members of Congress, and planning and attending meetings with stakeholders. Many local, regional, and national and international NGO meetings are happening on a virtual platform, especially in this COVID era that we're in. With the virtual option of participation, some of these meetings are open to the public, and you might want to check organization websites to find an area that you're interested in to determine if participation is an option. Next slide, please. So this slide speaks to all of the SDGs, and number 3 is good health and well-being. So what are the SDGs? They're a set of 17 goals and 169 targets, which are sub-goals adopted by the United Nations in 2015. They cover a broad range of sustainable development issues for the world, including health, poverty, climate change, and gender equality. And these are to be achieved by the year 2030. SDG number 3 is good health and well-being, and this is specifically targeted at ensuring healthy lives and well-being for all. Health, nurses, and nursing all play a key role in achieving the SDGs. Well, nurses, we're key to achieving the SDGs because we work in close proximity with communities, and we're critical to empowering individuals to be advocates of their own health. We're a crucial link between the community and the healthcare system, and we have a moral imperative as nurses to advocate for positive change. It's our world, it's our health, and we're one humanity sharing a planet. So as nurses, celebrate your achievements, share your stories, and use your voice to lead. Next slide, please. Reducing inequalities. Reducing inequalities requires work on a host of societal issues such as the patient-provider discordance, gender and racial wealth gaps, lack of diversity in the workplace, and implicit bias. So combined, all of these issues have contributed to a large wealth gap between Black and white Americans. The United States Census data shows that about 1 in 5 Black people in the United States live in poverty. In 2016, the median wealth of white households was $171,000, and the median wealth of Black households was $17,100. The Federal Reserve says that Black Americans are less likely to receive an inheritance, which sets the next generation up for financial failure and falling behind financially. So action items to improve inequities include promoting a diverse workforce, reducing the gender-racial wealth gap, reducing institutional and interpersonal bias, and then we have these action items that we need to improve, such as diverse and inclusive hiring practices, holistic admission processes, particularly to universities and university programs. Implicit bias training, promoting the nursing profession and combating incivility. Incivility occurs on so many levels, the academic level, in practice, and this is something that we have to get a handle on. I'm going to now pass this on to Dr. Hawkins.
Thank you, Valerie. And I think I'll be continuing with advocacy actions that we can take to impact the SDGs. And I think it's notable that Arik mentioned that at the United Nations, when we're there, a lot of times the representation occurs in the hallways, but our advocacy actions occur where we live every day in our workplaces and in our homes. So, for example, one of the SDGs that nurses can impact every day is SDG 13, climate change, and that overlaps with SDG, one of our favorites, good health, SDG number 3, and SDG 12, reducing our ecological footprint, which includes responsible consumption, as well as other SDGs. As you can see on the slide, hospitals generate 5 million tons of waste each year, and that's 1% of non-residential land waste. That's a lot of that waste is actually clean trash, and it's due to overstocking and oversupplies. So as nurses in the clinical setting, we can just think about how much unopened and unused clean trash we dispose of. And we also wash 10 million pounds of linen annually. Some of that linen that we washed was actually never used, and I can relate to that. I have 4 kids, and I can tell you when they were growing up, it was definitely a pet peeve of mine when clean trash or clean laundry would somehow end up back in the dirty clothes to be washed again. So a lot of that was really wasteful. So nurses can contribute to waste reduction in a clinical setting with some of these action items like linen efficiency and supply waste reduction and even hospital compost programs. Also related to climate change is our transportation, including commuting back and forth to work. That accounts for 28% of energy consumption in the US. One of the SDG targets includes increasing remote work opportunities to contribute to reduced energy consumption. Now, of course, I realize nurses on the front lines can't usually commute from work, or they can't usually work from home, but they could maybe walk or carpool if mass transportation is available. For nurses who are not involved in direct care, like I am now that I'm in education, I can work from home when that's possible, and that really contributes to reduced energy consumption. The next slide, please. This is really, I love this slide because this really shares a specific example of how nurses can impact the SDGs every day right where they work. This is a slide from an initiative right here in my home state of Virginia where a team of nurses work to reduce waste in their clinical setting. And you can see from the slide the impact that they had on both linen efficiency and reducing waste through supply reduction, but also proper waste sorting, which contributed to both positive environmental outcomes. And you can see on the slide that it also saved their facility a lot of money, so they were highly favored there. The way they did this is they educated staff about reducing PAR levels in the room, and they reduced their policies related to how often we change the bed linens, and they changed those policies. They were also able to reduce hospital clean waste that was no longer sterile or couldn't be used in the patient setting by instituting a donation program, and they donated some of this to schools of nursing, and they were also able to improve their waste sorting, so they made sure that trash that didn't belong in the red bags didn't go in the red bags. So they ended up donating over 87,000 pounds of medical supplies to educational programs and nonprofits. And due to their re-education programs, they improved their sorting waste and their total annual amount of red bag waste. So next slide, please. And this next slide is to share some examples of the impact of actually remote working to several of the SDGs. As you can see on the slide, they're working remotely 2 or 3 days a week can reduce a person's travel needs by 10 to 15%, which could impact our affordable and clean energy and climate action slides. Working from home also saves office energy costs. Now, of course, we might be using more energy when we're at home, but we can adjust our settings at home to our personal comfort levels. So I know sometimes when I'm in the office in the middle of the summer when it's 90 degrees outside, I sometimes have to wear a sweater because I'm too cold in the building. So at home, I can leave my house just a little bit warmer. That's more comfortable for me. And of course, I'm motivated at home because I'm saving my own energy cost at home. But working from home also contributes to reducing traffic fatalities, and there's more time for sleep and exercise, so that's better for our health. I just read this morning in another conversation that traffic fatalities worldwide are the 8th leading cause of death around the globe, and that's for all age groups, not just younger age groups that are usually even further impacted by that. Remote work opportunities also contributes to SDG number 5, gender equality, and it does this by allowing us to have better work and life integration, which might mean more opportunities for women to move up the ladder, so they can still, a lot of times they're more involved with family care, but if they're able to do what they need to care for their families and then still work, then a lot of times they have more work opportunities. So next slide, please. And a little more, I think, as part of this conversation about remote work opportunities, we don't want to forget that working from home opportunities are not always equitable. I think COVID-19 really showed us that there's a digital divide for some families who don't necessarily lack reliable access to the internet, and that limits their opportunities for remote schooling and also for remote work from home. So I think as nurses, one of the things that we need to do is advocate for infrastructure that contributes to more reliable internet access for all. Typically, high income, high education brackets are more often able to work from home. Women are disproportionately, as we kind of mentioned on the last slide, disproportionately caregivers at home. And just to give you an example of that, in Albania, I read this on the World Health Organization site, women spend 8.5 hours daily in domestic work compared to 1 hour a day that men spend. So there's a disproportionate opportunity in the amount of work that we do at home caring for our families, which reduces our workplace setting. In some places, COVID has also contributed to, or I guess COVID didn't contribute to it, but working from home more often meant that there was more domestic violence and isolation at home. So we need to advocate for the funding, the infrastructure for the digital divide, as I mentioned, but we also need to promote family-friendly workplaces when possible, including flexible work schedules, compressed work weeks, and job sharing, and create more opportunities for all of us. Next slide, please. And this was actually Penny's slide. She was going to be here today and had trouble connecting with the internet. Speaking of connecting to the internet, so what she was going to share today is actually. Oh, are you here, Penny? All right, then I'm going to pass it over to Penny. Fantastic.
Hi, everyone. Thank you, Janice. I'm going to be talking about not only enhancing what UN liaisons do and what nurses do every day, but what are ways that we as UN liaisons have operationalized that, and how can you operationalize advocating for everything that we've been talking about so far. I'm going to give you a few examples of ways that the UN liaisons have been actively trying to enhance the message about nurses achieving the Sustainable Development Goals and what we do in order to, in the ways we do it. We did write an article, a couple of articles together. One of them came out in April 2021 in AJN about nursing achieving the Sustainable Development Goals. This is a great way of better understanding the beginnings of what we're doing in regard to the SDGs. Next slide, please. And then in February, Janice and Val presented at the Healthy Work Environments Forum, and they talked about how workplaces and what workplaces can do to achieve the Sustainable Development Goals, not just the workplaces, but also those people in it. And as we all know, COVID has changed things significantly. And this discussion they did on healthy work environments really hit home for a lot of us because of the changes that have occurred because of the pandemic. Could you, next slide, please? We also did a presentation with this in the civil society briefing as part of ECOSOC for the UN. Sigma is part of the civil society, and we work on in different ways with civil society and doing presentations and attending meetings as well. Next slide, please. An exciting opportunity that's coming up is the new Global Nursing Advocate Academy. This is going to be offered by Sigma to all Sigma members, and it will be it is being designed and will be taught by former Sigma UN liaisons. This academy is going to be really exciting and new opportunity where you can learn to hone and to operationalize your advocacy skills in work. It will be offered online virtually and will begin in May of 2022. The exact dates are still to be determined. What's going to be exciting about this is that if you are just beginning to or want to enhance your global knowledge and engagement, you should consider taking part in or participating in this academy. It's the first of its kind for Sigma, and I think it will be really groundbreaking in helping people to really put those connections together in order to be more able to operationalize what they're doing globally, and also to potentially consider being involved in the UN going forward to the future. Next slide, please. This was another presentation that the liaisons gave at the last biennial. We presented this also, Dania and I also presented this to the Nightingale Challenge participants. And again, another example of how we try to influence global health care through nursing, the UN, and the Sustainable Development Goals. Next slide, please. And here are some more Sigma resources. Sigma has worked diligently on putting together many resources for you to utilize in your work and in your advocacy efforts. We will be at convention in Indianapolis in a couple of weeks, and we would love to have you come by our booth, engage with us, and get some of the materials. We have some SDG flyers and other handouts that will be available. We'll also, we are also putting together an SDG monthly toolkit that is hopefully going to be starting being available on the Sigma website in January, and on a regular basis we will be posting toolkits on each SDG for you to use locally in your chapters and in your regions. Also, convention's a great way to make many global connections. Over the years, I've made many friends and colleagues through Sigma's conventions, biennials, and conferences, and I think it's just a great way to see that we're all coming from the same angle. Maybe we're in a different language or from a different country, but we definitely want to make those global connections to make everything we do even more meaningful. And again, the Global Nursing Advocate Virtual Academy, which is coming up in May, is a great opportunity for you to become even more knowledgeable and engaged in all of this. So if you're interested in becoming more engaged, here are some ways to do it, and we're happy to answer any questions you might have about that going forward. Next slide, please. And I'm going to be handing this over to Dania now.
Hi, everyone. So these are some resources that we made that you can use to become more of a global health advocate and help build a foundation for transformative impact. So we we decided to categorize them into under categories learn, lead, and engage. So for the Learn slide under Sigma, here are some resources that are available to you where you can learn more about becoming a global health advocate. So like previous presenters have mentioned, our biennial convention is coming up. This year, the theme is Honor the Past, Remember the Present, and Create the Future. It'll happen in November 6th to the 10th in Indianapolis. The International Nursing Research Conference is coming up in Scotland in July of next year. You actually can still submit an abstract. I believe the deadline is November 3rd. Sigma has various webinars on relevant topics, and you do have access to previous webinars like Penny mentioned that we've also done. Sigma also has its own podcast that tackles popular topics throughout all areas of nursing. And then there's also the Sigma Advocacy online program, which is what Penny mentioned a few slides ago. Under the UN, they have a couple of programs in place that really focus on global health advocacy. So their first one is the Institute for Training and Research. This is the dedicated training arm of the UN. And so they really provide training and capacity development activities, which I'll mention a little bit in the next slide. They also have the Sdg Academy, which they offer a bunch of free online courses and educational materials on, the SDGs and sustainable development. They also have, their UN Summer Academy, which is an engaging 5-day program. And it is online this year that really fosters rich interaction on issues that are relevant to the UN and its partners. They have their UN SDG Learn Initiative, which really helps to bring relevant and creative learning solutions on sustainable development topics. Here you can find courses and micro-learning, which is what I really like to do. You can also visit the New York headquarters when they open up again and subscribe to their newsletters and look at previous events on their UN Web TV and other live podcasts. Next slide. So under the lead category, this is what I really am passionate about. So Sigma has several leadership academies. They're all listed here, and they're actually accepting applications for the next cohort of Sigma academies that will begin in 2022. The application deadline is November 17. So if you feel like this is something you're passionate about, apply, because this could be the start of your career in nursing leadership. They also have the Nursing Now Challenge, which was previously called the Nightingale Challenge. I was a participant, and I really loved how it helped me develop, my leadership skills as a young leader and a practitioner and a health advocate. They also have their Center for Excellence in Nursing Education. This center really helps provide, career and leadership development opportunities for academic nurse educators. Under the UN, this is kind of how I mentioned with the Institute for Training and Research. Here's a couple of the programs that they have. So they have one called the UN Young Leaders Training Program. This is an online program that's specifically designed for global youth. So if you know anybody that's interested, they can sign up. They also have the UN Immersion Program, which really works on more of developing knowledge and skills in diplomacy. They also have their diplomat training program. And, those all fall within the core diplomatic training section of the UN. Next slide. So under the Engage category, there's a few ways that you can get involved with Sigma. So you can join the global regional councils, and they really serve as regional champions for Sigma. They really help bring up concerns that your region is facing to the forefront. You help identify actionable items, and you also spread the work that's essential. You help spread the word about the essential work that Sigma is doing. You can also join our team. You can sign up to be a UN liaison and youth representative. They are still accepting applications for both roles, and the deadline is November 17. If you are a youth, or if you're interested in the youth representative role, you can feel free to email me or message me. Our contact information is coming up in a couple of slides. You can also join the Circle, which is a great platform. to interact with chapters and members from all around the world. You can also interact with Sigma social media. I know they're active on Twitter, LinkedIn, Facebook, and Instagram. And if you're looking for ways to engage with the UN, you can volunteer with the UN, both in local events and global events. You can intern with the UN. You can volunteer to teach an SDG course and also interact with them on social media. Next slide. So here are some upcoming events that are happening at the UN that we wanted to kind of shed some light on. So the UN International Day for Education is going to be January 24th. So this day really celebrates education worldwide. The World Day for Social Justice is going to be February 20th. That is an international day that really recognizes the need to promote social justice. The International Women's Day is March 8th, where we all get together to celebrate the achievements of women. And then the Commission on the Status of Women is going to be in March 2022, which Sigma is involved with. So the CSW is kind of a body within the UN that's exclusively dedicated to, the promotion of gender equality and the empowerment of women. So their 66th session of the CSW will take place in March 2022. So look for further information on how to get involved and attend events that Sigma will be hosting. And then last but not least is the World Health Day, which will be April 7th. During this day, they really draw attention on a specific topic of concern to people all over the world. I don't think they've released their theme yet for this year, but that is a great event to attend. And then you can learn, there's a lot of events on the UN that you can attend virtually. So down here, you'll find the link on where you can find events. So if you need to contact us, here is all of our contact information. Please invite us to attend or even speak at your next regional conference or chapter meeting. I know I'm presenting at the Region 2 conference that's coming up in December. So invite us, engage with us.
We would now like to open for question and answers. So please feel free to submit your questions using the question feature and make sure to hit send. Thank you. We had an individual asking how to join the UN, and I wanted to make sure that their question was answered correctly. Dania, do you care to explain that part again?
Yeah, of course. So if you go online to the Sigma website and you type in like Sigma UN, there will be a call for applications, and there is also a really great description there that describes your responsibilities and what you're going to do within each role. And then I remember when I applied, it was a pretty quick process, but maybe Penny or Janice can elaborate on the liaison role, and Arik as well, and Val.
So the UN liaison role is, there are 4 of us, and we work very closely together in trying to coordinate who goes to various meetings at the UN. The application process can be found on the Sigma website. We are currently looking for 2 new UN liaisons, and we're overlapping the terms so that there are seasoned liaisons with the new liaisons. And again, the Global Academy, which is coming up, will also give you a lot of information about looking to the future and trying to be involved as a liaison or a youth rep.
Can you please explain more about the implicit bias training?
I can speak to that. So implicit bias training, I was just mentioning it as an approach to deal with some of the inequities that we see in healthcare. And a lot of facilities and universities have developed their own specific implicit bias training programs. And these programs actually help us as individuals recognize our biases and keep those in check as we're interacting with patients, populations, communities. And that's pretty much what was meant by implicit bias training. We've had a lot of research that shows that implicit bias has a really big outcome, a big effect on health outcomes. So we want to make sure that we kind of recognize that as we care for our patients.
How long is your appointment as a Sigma UN member?
So it's 2 years, and then you can be invited to do another 2 years, but the max amount is 4 years.
And if I could just piggyback on top of that as well, I think it's important to really come back to the all the information that you have received today. There are so many opportunities to become involved with the United Nations and with Sigma at the UN, even if you do not want to be in a 2-year commitment. You can do everything from watching their meetings online. You can join us in New York, actually, if you want to come hang out at the UN. There are opportunities to do that. So don't be afraid to really reach out and explore ways that you can get involved if the liaison or youth rep position is not something that you think you have time for.
How can I find out how to connect with my Global Regional Council? I live in Florida.
So I can actually take that. This is Megan from Sigma. That is something that I assist with. Currently, the Global Regional Council is made up of the regional coordinators and the presidents in those regions coming together, and then they do also take nominations for other representatives to participate. So moving forward, we will start a new council here coming up. And so that information will be shared with chapter leaders. So you may see an opportunity to participate in that moving forward.
What is required to be a liaison besides being a nurse?
Since I'm the newest member, maybe I can comment to that. And there is a job description that we can share. I believe that's actually available as part of the application. So that may be something to take a look at. But I think it's more that there's not specific requirements as far as you do have to be a nurse, you do have to be a member of Sigma, and then we do apply for and receive our grounds pass and things like that. But the application process is your resume, and then you go through an interview process. And a big part of that is that you have an interest in promoting the SDGs and representing Sigma at the the United Nations. And then as Penny shared, as part of her slides, a lot of the things that we do too are related to education and promotion and awareness. So I think that's a skill set that you want to bring and an interest that you want to bring as different ways to share. And that could be through some of the publications and presentations, but also reaching out to your own chapters. Like Dania said, she'll be presenting at the regional chapter, but as well as using things like social media and any ways that you can reach out to different members to help increase our knowledge of the SDGs. So that might be kind of a roundabout way. The application specifically lists the criteria and the process, and then that's it tells you what the job description is about. So that may give you another way to look at it. Anything to add to that, Megan, maybe?
Nope. Yeah, I put the link in the chat to the application and the description information. So you can feel free to look at that. And then there is an email if you have additional questions.
I do want to mention that if you're not very familiar with the United Nations or everything that goes on within the UN, I know that you have a great team that you'll be working with, so don't let that discourage you from applying, because even though we all kind of had that global involvement and we had that experience, we went, or at least I went in not really knowing what was going on at the UN, and I quickly found support coming from all directions, including Sigma, including the global department and my fellow liaisons.
To be a liaison, could a nurse be anywhere in the world as long as he or she is a member of Sigma?
Yes, we love global representation.
Yes, and I do think that Sigma really wants to get as diverse of a group of liaisons and youth reps as possible. Going forward, we have been, setting up building blocks for the future liaisons. So yes, yes, the answer is yes.
I am Hispanic. Is it necessary to speak English to apply to be a UN liaison?
Megan?
Yes, hi, I'm here. So I can tell you that most of our presenting, our writing, everything like that will be conducted in English. So you do want to make sure that you have a good grasp of the English language in order to, be able to effectively communicate, during your presentations, if you had to do so, and in writings and things, articles and things like that.
And then how involved are Sigma International chapters with your liaison group in the UN?
Well, I know that a lot of groups come into the talks that we've given. I know when Donnie and I presented for the Nightingale Challenge, we had people from all over. The biggest challenge for that was finding a time when everybody could come in. So yes, absolutely. We try to engage people globally as much as possible.
And I know, Penny, to add to that, when we're at some of the presentation things that are offered through part of the UN and even the side events, that attendance is definitely global. In fact, some people are waking up in the middle of the night to attend different events. So certainly there's a very global presence there too, in addition to right within the liaisons.
Also, the really good thing is, if COVID was anything good about it, was that it increased, participation from global, global communities. So I live in Los Angeles, so there's a 3-hour time difference, but I haven't really had a problem with it. And I know that with all the online formats and all the platforms, there's a lot of ways that you can engage if you are in a global, coming in globally.
And that's a great point, Donnie. I did hear the organizers for the CSW. They mentioned that last year when CSW 65 ended up going virtual, they had attendance of like 25,000 people across all the platforms. So, I mean, that was a pro, if we can come up with one, that being virtual increased access for sure.
Yeah, and Sigma too has really committed to increasing, participation amongst members by offering virtual and, in-person events.
And then do UN representatives have to live in New York City? And how many times does a representative go to the UN?
None of us live in New York City. Some of us live closer than others. Penny lives in Connecticut, and Arik's in Chicago. I'm in Philadelphia, and Donnie is in New York. So, and we kind of take turns, and we kind of pick events. Like if I'm free, I may go to certain events, and if Penny is free, she may go to certain events. And sometimes if they want someone to if we want someone at a particular event and it's kind of last minute, one of us, either Penny or I, might go because we're somewhat close. We're about a 1.5 to 2 hour commute from New York City. But you don't have to live in New York to be a UN rep at all. You can live anywhere, actually anywhere in the world, because Sigma is trying to diversify like the whole UN team.
And also a lot of the, to piggyback to that, Val, a lot of the UN meetings now that are virtual, I think they'll continue to keep them virtual even when we go on ground, because it has offered the opportunity for more people to be involved and engaged. And I think that the UN will continue to do that. I've gone into virtual meetings. There are 30 people in the meeting, or there are 1,300 people in the meeting. So it's really opened a lot of doors for people. And I think more people are that, like Janice said, the virtual opportunities are actually being strengthened in more communities so that people can get online and be in the meeting.
There are some requirements. I think you have to attend 2 UN-based events. You can find that under the role description, under the youth role and the liaison role. So I do want to mention that.
And I was actually just going to add that I have yet to have been to the United Nations. I've been previously before I was in this role, but since I've been in this role, I had my bags packed in March of 2020, ready to walk out the door. And we all got a call that, that the world shut down at that moment. And that was actually for the CSW 65, and it went virtual. And of course, everything since then has been virtual. So everything I've attended has been virtual. And a lot of our concentration, I think this year too, has been to increase awareness and education and promote the SDGs that we can all do from wherever we are. Like the slides we were sharing, is what can we do in our workplace and in our work settings to promote the SDGs. And within our chapters, as Art mentioned, 85% of our chapters are doing activities that promote the SDGs. So a lot of it does happen at home. I do hope that this year I'll get to travel with this group somewhere, but a lot really can be done at home.
I know you briefly touched base on this earlier, but what is the hour commitment in the 2 years as a liaison? Does being multilingual help with the application process? And what should I do to be a good potential candidate?
I have to say that Sigma has because this is an unpaid position and it's a volunteer position, and Sigma encourages us to be as actively engaged as we can be, and clearly based on your work, etc., that will vary from month to month. But all of us try to be as involved as we can be, and that just supports everything we're doing and really gets the word out more the more we can be involved. But there is no Sigma wants us to go to a couple, 2 or 3 things if possible, but there is no specific number other than that they have told us that we need to do. Unless, Megan, if you have other information about that.
Nope, we don't have a specific set number of hours, that are required for the commitment. We understand that everybody has other, employment and personal lives and things like that. So we want to make sure that we respect that, and we appreciate any contribution that the liaisons and representatives can give when they can.
I just wanted to address part of that question where they were asking about being multilingual. Generally, like the statements that we give from Sigma will be in English. However, like if you do speak a lot of languages, you might be able to network with a lot more people. There are some of the large meetings, like the CSW meeting, there's so many people there from so many different places. So it would definitely like widen the network of people you're able to communicate with. So I'd say that it can only be an advantage or plus.
Yeah, and if I could point out as well, there are multiple UN headquarters around the world, Nairobi, Vienna, Geneva, New York. Help me if I'm forgetting any, but if timing is an issue, you can always participate with the headquarters that's closest to you. And then kind of backing up what Valerie said, I think speaking more than one language is great because the UN does function in 6 primary languages. So whether or not you speak one of those 6, I think would be very helpful when you're on the ground or participating remotely.
And I do want to mention, I'm a full-time student and a full-time nurse, and this role really taught me that if you're passionate about it, it's possible. So that's the great thing about the UN and Sigma, is that there's so many different resources and events that are available to you, that you do what you're passionate about, and always think about how can you bring this back to Sigma members, and how can you use this to further Sigma's mission. So always have that that thought in mind, and find programs that are passionate and that align with your values and what you can, help grow.
I have another question. Given the flexibility of hours for the liaison, why do they require a letter from your employer?
I'll go ahead and take that. So we want to make sure that your employer would support you if you wanted to request time off to attend an event in person. So we just want to make sure that you're not going to jeopardize your position or your role or anything for your employer, and that they understand that you volunteered for this opportunity. So that's the purpose behind it.
Are there any other questions at this time? We got lots of excellence, and thank you for your presentations, by the way. So just wanted to let you know.
Thank you.
We really hope to meet as many of you as possible at convention. We, are so happy to be able to do both a blended, virtual and in-person session, but also just like we are here to serve you and to hear your stories and share what we've learned. So come by the booth and let's talk and figure out how we can get, more of this work and information down to your chapters or even down to you as an individual.
All right, I don't see any additional questions at this time. So we want to thank you so much to our presenters today for all this great information. Sigma is grateful that you took the time to share with the audience and look forward to hearing more from you in the future. We hope you enjoyed this webinar. As a reminder, 1 week from today, we will email you a link to the evaluation for you to obtain your CPD certificate. Be sure to check out Sigma's upcoming webinars, podcasts, and resources to support you and your colleagues at sigmanursing.org. Thank you for joining us and have a wonderful day.